All right, everybody, this is Dr. Shea with Align Life Chiropractic and Wellness, and today we are doing episode 5 of the 5 pillars of chronic disease. We've got only this video and one more to get all the way through this fantastic series that's going to help to dramatically reduce your likelihood of developing a lifestyle disease. Remember, these are cancer, stroke, hypertension, heart disease, diabetes, osteoporosis, and obesity. These cause 80% of the reason why people pass away in the United States of America. Today, we're going to be talking about decreased sex hormone binding globulin. Difficult name, simple concept, guys. So, what is sex hormone binding globulin? What sex hormone binding globulin does is it is secreted by the glands in our body and the organs in our body responsible for sex hormones and recreation. The testicles and the prostate in men, breasts and ovaries in women. So sex hormones like testosterone, like estrogen, like progesterone, these are all secreted out into our bloodstream and helps to regulate the creation of new cells, growth, recovery, and so forth. So if you have appropriate levels of sex hormone binding globulin, this is secreted by the body, it goes out into the bloodstream, gathers up any extra of these hormones, and stores them, eliminates them, gets rid of them so that they don't cause problems. It's your body's way of maintaining homeostasis in the system. However, if we have a chronically stressed lifestyle from how we eat, a lack of movement, if we're stressed out, if we don't maintain our mental headspace, if we have chronically poor postural positions and put stress on the nervous system, if we're not getting enough sleep, if we're chronically dehydrated, then ultimately the body is forced out of that homeostasis and it's forced to adapt. And in that long-term adaptation, we can actually see a decrease in sex hormone binding globulin, which means it's not out in the bloodstream, which means we have extra sex hormones that are being secreted and pushed out into our system. Now, in the big picture, when we talk about not short-term adaptation, but we talk about long-term deal, what we find is that testicular cancer, prostate cancer, ovarian cancer, and breast cancer, as well as things like PCOS, diabetes, heart disease, and obesity can all be caused by decreased sex hormone binding globulin. So when we talk about site-specific cancers like testicular cancer and breast cancer and so forth, which, by the way, guys, are some of the most common cancers that are out there, this is one of the most common reasons why this happens for people. Now, the question that you should be thinking is, well, how the heck do I eliminate my likelihood of having these types of issues? Cool part, guys, is that it all comes back to the simple things that we've been talking about throughout all of our educational series, which is you need to be eating well, moving well, thinking well, and you need to be structurally well. We also recommend getting adequate sleep and adequate hydration. If you can do these things, all of them over a period of time, at the same time, then your body will have the opportunity to heal. It will have the opportunity to get back into homeostasis and ultimately eliminate your likelihood of having all of these issues. So please, if you're interested in more information on this type of topic, there's a number of websites that are out there that you can find that are specific to sex hormone binding globulin, because this has become a very important topic in the media and in healthcare. So take a look at that. Otherwise, think about your eat, move, think, and structure, and how you are implementing your strategies on a daily basis to help drive your body to health and homeostasis. I hope that you guys have enjoyed this topic, and I look forward to speaking with you one more time in this video series. We're going to do episode number 6, the last of the 5 pillars of chronic disease. I'll look forward to seeing you next week. Take care.